In this video, we will learn how to interpret an ABG, that is arterial blood gas. And before we go deep into the analysis of ABG, let us take a brief look into the basic concept of acid-base balance. Now, acids such as hydrochloric acid and carbonic acid donate hydrogen ion, that is proton, and bases such as bicarbonate and ammonia accepts proton. This balance is further regulated by the kidneys, the lungs, and the blood buffer systems. With all these efforts, the blood pH is maintained at a narrow range of 7.35 to 7.45. Now, the pH is nothing but the negative log of hydrogen ion concentration. So, if the hydrogen ion concentration is high, then the pH will be low since it is a negative log. Similarly, if the hydrogen ion concentration is low, then the pH will increase. With this background information, now let us dive in to the actual arterial blood gas. Now, ABG has three main components: the pH, the PaCO2, and the bicarbonate. pH, as I said earlier, is the negative log of hydrogen ion concentration. The PaCO2 is the partial pressure of carbon dioxide in the arterial blood. The pH tells you whether there is acidosis or alkalosis. The PaCO2 and bicarbonate levels tell you whether the acidosis or alkalosis that was told by the pH is due to the respiratory system or the metabolic system, and also whether there is compensation or not, and how much compensation, if there is. Now, coming to the normal values of these three parameters, the normal value of pH is between 7.35 to 7.45, and the normal value for PaCO2, that is partial pressure of carbon dioxide in the arterial blood, ranges between 35 to 45 millimeter of mercury, and the normal bicarbonate level is between 22 to 26 milliequivalents per liter. Now, if the pH is low, meaning less than 7.35, there is acidosis. And if the pH is high, meaning more than 7.45, there is alkalosis. So, the pH will tell you whether this blood sample or this patient is in acidosis or alkalosis. Now, if the PaCO2 is low, meaning less than 35 millimeter of mercury, there is alkalosis. And if the PaCO2 is high, meaning more than 45 millimeter of mercury, there is acidosis on the respiratory component. Now, if the bicarb level is low, there is acidosis on the metabolic component, and if the bicarb level is high, it indicates alkalosis on the metabolic component. Now let us look at this example. The pH is 7.10, which is low, meaning acidosis. The PaCO2 is 80, which is much higher than the normal range of 35 to 45 millimeter of mercury, indicating acidosis on the respiratory component. And lastly, the bicarbonate level is 29 milliequivalents per liter, which is also high, indicating alkalosis on the metabolic component. Since the pH is low, we know that the patient is in acidosis, and whether this acidosis is due to respiratory or metabolic component will have to be determined from the PaCO2 and bicarb levels. Here the rule is that the disorder agreeing with the pH is the primary defect. When we look at the bicarbonate, it shows alkalosis, which is not agreeing with the pH, which shows acidosis. So the bicarbonate, that is the metabolic component, is not the primary defect here. Now look at the PaCO2 level. It is showing acidosis, agreeing with the pH. So the primary defect here is the PaCO2, meaning the respiratory component. Now the primary acid-base disorder of this ABG is respiratory acidosis. At this point, you must be wondering, what about bicarbonate? The pH and the PaCO2 are in agreement, so it is primary respiratory acidosis. What is the significance of bicarb level here, or why is the bicarbonate level high at 29 milliequivalents per liter? The answer is compensation. The PaCO2 is high, causing a low pH. Since a low pH, meaning acidosis, will be harmful to the body is trying to raise the bicarbonate levels to bring back the pH to normal. This is known as compensation. We must understand here that these compensations are usually insufficient to bring the pH level to normal unless the primary defect is corrected. That was all about the basic ABG interpretation, identifying the primary acid-base disorder. In the next video, we will talk about compensation in detail.